How lovely to see you. My name is Florence Nightingale, and I'm delighted to have been able to travel through the pages of history to be with you today in 2020. Goodness me, 2020? That makes it my 200th birthday year. How time flies. It's hard to believe that 2 whole centuries have passed since I was born on May 12th, 1820. And you have been so kind to honour me by making 2020 the International Year of the Nurse and the Midwife. And what wonderful work your nurses and indeed midwives are currently doing in this challenging time. Now, I believe that many of you watching me today are children, and that I have already had the pleasure and the privilege of meeting some of you in your schools, and I so look forward to meeting many more of you in person in the future. If you haven't met me in your school, I'm sure you have learnt about my important work at Scutari Hospital during the Crimean War. Now, you may have heard of the nickname that I was given, the Lady with a Lamp. It's because I walked for miles every night, carrying my Turkish lamp through the hospital wards, checking on the poor soldiers. Not a nickname I would have chosen for myself, though. No, I am much more proud of a different nickname, the Lady with the Hammer. That's right. When my nurses and I arrived at Scutari Hospital, the men in charge refused to give us access to medicines, bandages, and vital equipment for cleaning, all essential things for carrying out our work and caring for the patients. So do you know what I did? I took up a hammer and I beat down the storeroom doors. Oh yes, I was very determined. But I do hope that no one currently working for the National Health Service, otherwise known as the NHS, is having to do anything quite as drastic with a hammer. I soon discovered that infectious diseases were spreading throughout the hospital, as well as rats running amok everywhere. Oof. So I didn't just use my hammer, I also had to use my brain. Now, I had always been very good at mathematics, and by using numbers, statistics and graphs, I worked out that the main problem in the hospital was a lack of cleanliness and good sanitation. Sanitation. That's toilets, clean water, and plumbing to you. Once I knew what the problem was, my nurses and I worked tirelessly to get everything ship-shape. Or perhaps that should be hospital shape. When the war ended, and I returned to England, I was even more determined. I set up a proper training school for nurses, the Nightingale School for Nurses at St. Thomas's Hospital in London. And you have named your special new hospitals after me. Nightingale Hospitals. I am so honoured. And indeed, I'm very moved to discover that the work I did all those years ago improved conditions in all your hospitals and has made nursing a valued and respectable profession. What else did I achieve? Oh yes, I wrote many books, including Notes on Nursing, in which I advised on the importance of cleanliness. There I go again. Cleanliness, cleanliness, so very important. I always knew that hand washing was the single most effective means for stopping the spread of infection. But do you know, I never had the idea of singing Happy Birthday twice over. What an inventive way to ensure you do it for long enough. To all current NHS staff, the nurses, the doctors, the cleaners and the porters, and to all healthcare workers around the globe, I say keep up the marvellous work you are doing. Your dedication, care and bravery will not be forgotten. And dearest children, perhaps I have inspired some of you to become the great medical professionals of the future. And to everyone, I say, in fact, I encourage you, please do your bit. Stop the spread of infection, keep your distance, and wash your hands often. Happy birthday to me, happy birthday to me, happy birthday, dear Florence, happy birthday to me. Yes, it's rather good, isn't it? And it is my 200th birthday after all. Goodbye, everyone. Happy birthday to me, happy birthday to me, happy birthday, dear Florence, happy birthday to me.